Shortages at Wake EMS are having an impact on ambulance response times. Thanks for joining us, everyone. I'm Rod Carter.
And I'm Angela Taylor. We've been reporting on this for months. CBS 17's Galat Malaman's learned it's a situation that's happened more often recently. And Galat, why is that?
Rod and Angela, Wake County EMS says it's happening more often because there's a staff shortage and an increase in volume. That creates a perfect storm for no ambulances on the road.
Let us know if you do need EMS. We're out of units right now, so we're at level 0 right now.
That was one of 8 level 0 conditions in November, which means no ambulances are free.
Typically, it is not a very long time.
When CBS 17 reported on the issue in May,
I've been working here for 15 years, and I've known of 2 occasions that has happened.
the situation's become more common the past 7 months. What changed? You went from 2 instances in 15 years to multiple times in a month.
The call volume changed.
Wake EMS Assistant Chief Brian Brooks says May was the first time the department hit 10,000 calls in a month with 3 instances of level 0. That's when all ambulances are already responding to calls. It peaked in August with 24 level 0s. The first month Wake EMS hit 11,000 calls. Brooks emphasizes even in those situations there will always be an ambulance available in an emergency. A low system resource response plan kicks in at 10 available ambulances.
Let's say a heart attack happened and we were at level 0. Somebody who was en route to another call would get pulled to go handle that heart attack because it's a higher level.
Brooks says call volume has the biggest impact, but staffing shortages also play a role. The department has 63 vacancies out of just under 500 employees.
We need people to apply.
For people who don't have an emergency but call for an ambulance when none are available.
And typically those are the people that are complaining because they're the ones who end up waiting. The emergency calls are not waiting.
The 4 FEMA ambulances that were here helping respond to calls did leave yesterday. Brooks says he doesn't think that's going to have a negative impact because November was the first time since May they had less than 10,000 calls, a trend he hopes continues. Live in Raleigh, Galat Malaman, CBS 17 News.